Mesothelioma is a rare and serious form of cancer in which the cells of the mesothelium become cancerous and multiply out of control. The mesothelium is a protective, two-layered membrane that covers the internal organs of the body. Between these layers, cells produce fluid that allows organs to be lubricated and to slide easily against other organs and surrounding tissues. Mesothelioma is usually found in the layer that covers the lungs, called the pleura, but it can also be seen in the peritoneum, which lines the abdominal cavity. Mesothelioma is almost always caused by asbestos exposure, but symptoms may not appear for as long as 50 years after the exposure. Some people may not have any symptoms, and most people with the disease exhibit symptoms for only 2 to 3 months before they are diagnosed. About a quarter of mesothelioma patients show symptoms for at least 6 months before they are diagnosed. Symptoms of mesothelioma in its early stages can resemble those of less serious conditions, such as viral pneumonia or even just increasing age. So many people ignore them or mistake them for common minor ailments. Since early detection gives doctors more treatment options and allows them to choose more effective and more powerful therapies, people who have been exposed to asbestos, even for a brief time, are encouraged to tell their doctors about the asbestos exposure and to have regular checkups to detect lung and abdomen abnormalities, even if they don't exhibit any symptoms of mesothelioma. Pleural mesothelioma symptoms. In pleural mesothelioma, almost all patients experience shortness of breath, also known as dyspnea, and or pain. This pain ranges from mild to stabbing and can be in the chest, abdomen, shoulder, arm, or lower back. Most patients will have pleural effusions, which is fluid buildups in the pleura, that can cause shortness of breath and chest pains, though many cause no symptoms and are discovered only after physical examination or chest x-ray. The right lung, which is slightly larger than the left, is affected 60% of the time. About 5% of patients show cancer in both lungs at the time of diagnosis. When listening to a patient's chest with a stethoscope, a doctor will find that normal breath sounds are muted and that tapping on the chest reveals dull rather than hollow sounds. Some patients experience trouble swallowing, coughing, fever, night sweats, fatigue, and weight loss. Other symptoms include hoarseness, coughing up blood, swelling of the face and arms, muscle weakness, and sensory loss. When fluid builds up in the pleura, breathing can even be more difficult while lying down, making it hard for patients to sleep. If symptoms suggest mesothelioma, doctors will generally order a number of tests. Imaging studies like X-rays, CT scans, and MRI can show any abnormalities within the lungs. A bronchoscopy, in which a viewing scope is used to look inside the lungs, may also be ordered. A complete blood count and levels of specific proteins can help make the diagnosis. However, the diagnosis of mesothelioma cannot be made by blood work and imaging studies in every case. Other more common diseases, such as benign asbestos-related pleural disease and metastatic adenocarcinoma, can have very similar appearances on imaging studies. Biopsies and the use of special staining are often necessary for the accurate diagnosis of pleural mesothelioma. Peritoneal mesothelioma symptoms. Symptoms of peritoneal mesothelioma include abdominal pain, weight loss, and swelling due to a fluid buildup or tumor growth in the abdomen. Other symptoms of peritoneal mesothelioma may include bowel obstruction with blockage in the large or small intestine, abdominal mass, nausea, vomiting, loss of appetite, breathing difficulties, and swelling of the feet and fever. If the cancer affects the liver, which plays a big role in producing the chemicals needed to control bleeding, patients may experience blood clotting abnormalities and anemia, a reduction in the number of red blood cells, which makes it harder for the heart and lungs to get oxygen to the parts of the body that need it. If the cancer has spread beyond the mesothelium to other parts of the body, symptoms may include pain, trouble swallowing, or swelling of the neck or face. With peritoneal mesothelioma, Some people experience nonspecific symptoms for months prior to a confirmed diagnosis. In some cases, the mesothelioma is found when the patient has sought medical treatment for another problem such as gallbladder, hernia, or pelvic mass.
Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.